What's up, y'all? This is Dr. Bartou with Pill Talk. I got my special guest here, Dr. Jessica Johnson. She's a VA pharmacist, also founder of Dream Secured Mentoring, that we will discuss. Dr. Johnson, you can introduce yourself, let them know a little bit about you.
Hi guys. Yes, I am Dr. Johnson. You call me Jessica. I'm from Anderson, South Carolina, but I currently reside in Illinois. I am a clinical pharmacy specialist for Captain James A. Lovell Federal Healthcare Center. It's a very long name.
Yes.
And I work in an ambulatory care setting within that facility.
All right, dope, dope. So let's talk about how did you get into that field? So after pharmacy school, what were the steps to become a critical care pharmacist?
So after pharmacy school, I did 2 years of residency. So kind of backtracking into pharmacy school. So I went to South University School of Pharmacy, now mainly solely located in Savannah, Georgia. So there was a campus in Columbia at the time. And that program was an accelerated program, or is an accelerated program. So it was a 3-year program. And so we went to school year round.
Yes.
It was great. But in that, you know, usually when I went into pharmacy school, I was like, I'm going to be retail pharmacist, because that's the only path that I knew at the time. So that was what I was going for. And then I made someone be my mentor, Dr. Marquita Winder. And she gave me the viewpoint of becoming a clinical pharmacist. So she was one of our professors, but she had an endocrine clinic at the VA, the local VA in Columbia. And so she put me on the path of what it takes to get into residency. So that's volunteering, having leadership roles in pharmacy school, good grades. I kind of cheated on that end. And then having really good clinical experiences as a student. And so she really helped me to kind of guide that. Doing research was a good big thing at the time too. And so Dr. Kendrick Ware, he helped me with a research project. And so from there, you do the application process. And so you do a first-year residency, which is just general practice pharmacy. So you get your hands into all of the clinical settings that are offered at the facility.
Yeah.
So, you know, like I wanted to do VA facilities because that's where my mentor was, and I also liked the independence that you can have as a pharmacist in the VA setting, or the autonomy. So first year residency was in Dublin, Georgia. And at Dublin VA, the real name is escaping me, but there it was a VA, and I did inpatient staffing, outpatient staffing, geriatrics, acute care, anti-coag, pretty much a gambit of training. And that was one of the toughest years I've ever had.
I bet.
Yeah. So, you know, you kind of try to figure out, you realize you're not as smart as you thought you were.
Mm-hmm.
And residency really shows you your areas of weakness or areas for improvement. And people really hone in on that. So it can definitely be a blow to your self-esteem. But it's all in the process of molding you and to be a better clinician. So first year pharmacy residency there. And then I thought I was going to go into palliative care and pain management. No, did not happen. So that would be my second year of residency. And in that year, you specialize. And so I interviewed for pain palliative residency programs, and I also interviewed for ambulatory care programs. Try to, you know, keep it spicy. But
Okay.
I ended up, I ended up doing ambulatory care here at Captain James A. Lovell. And so the second year, you're solely practicing in that particular area that you are going to specialize in. And so a lot of ambulatory care, which is chronic disease state management with veterans. Actually ended up doing pain management, and my facility is a federal facility. And so we see active duty military, we see retirees from the military, as well as veterans, because there's a difference, and different insurance. And then we also see dependents. So we see pediatrics, we see women. It's pretty much anyone from newborns to 105. Then that was my oldest patient, 105. And so, yeah, did my training there. And then they hired me on after that. I feel like I'm rambling. So do you have specific questions?
Nah, you're good. So what it really sounds like, the first year is general. You get to touch all the bases within the hospital as a pharmacist, with inpatient, outpatient, general hospital, you know, doing the IVs and all that. And then the second year, you become very more tuned in and just focus on that one. You had mentioned one thing, like the residency is very humbling. So like we all leave pharmacy school thinking like, oh man, I know what all these medicines are, I know what they do.
Yeah.
It's a difference from knowing what it is and actually practicing it, yo.
Yeah.
I can tell like the first year was one thing, that's that transition of knowledge base to application base.
Right.
Yeah.
And that's one of the reasons too why I wanted to do residency, because we learn all this information in a short time frame, right? And then we're expected to be a doctor of pharmacy once you graduate. And I was like, I'm gonna need a little bit of a, you know, safety net coming out here in these streets. So that was one of the reasons I did residency, because it really allows you to learn how to apply the knowledge that you gain in real life settings. And so residency gives you about 2 to 3 years of training in 1 year. And so that really helped me to make sense of the things that we learned in pharmacy school. Even like just when I graduated pharmacy school in June of 2015, and I started residency like the first week of July 2015. And so I didn't have like a month to study for my board exams or law exams. So I started residency and was studying for boards at the same time. And really a lot of the things that I was applying for my first set of rotations, or learning in my first set of rotations, was on my board exam. And so thankfully for that, it really helped me to, I'm pretty sure, pass my board exams. Law is a different story, but I passed it, but you know, by the grace of God.
That is good, because he was already practicing it and applying it, because, you know, when we take those exams, the national exam to become a pharmacist, the question isn't what is this medicine and how is it used?
Yes.
The question is more of, this person has this disease state, they take these medications. Now, can this medicine be incorporated in this and not interfere with the other ones? And you got to understand, like, okay, what are these medicines used for? Because they're not going to tell you the information. Like, so you got to have the knowledge of what everything else is used for. Does this drug have an interaction with any of these other drugs? And the actual person's state.
How they present. Yep. Yeah. So that definitely, that's one thing I like to tell mentees or students in general, especially in pharmacy school or in the medical field. Like, yes, it's great that you can pass an exam, but can you apply this to a real person? So, you know, taking into account the patients that you have on your exams, look at it as if it's a family member. And how would you treat that family member? I treat all of my patients like their family. Some of them probably are family at this point, you know. But yeah, it definitely helped with that aspect for sure.
I talk to my technicians and my staff, and I tell them, like, yo, everyone that comes through the door, we got to treat them like they're our favorite cousin. We happy to see them, and we also happy for them to go. You know what I'm saying? Let's let them come in, let's handle the business, let's laugh, let's joke, and be like, I'm gonna see you next time. So it's a warm welcoming, a hard goodbye, but we'll see you next time. We'll be right here.
That's a good outlook. That's a good, yeah. I like that.
So let's talk about critical care. Like, what do you actually do in the VA? Because there's probably someone right now who's looking at this and like, yo, I want to get into, I don't want to get into retail, but everyone thinks retail is the only way that retail and hospital is the only place for pharmacists. So let them know a little bit about critical care, what you actually do there at the VA.
Okay, sure. So in the VA, after doing residency, you're a clinical pharmacy specialist. And so for me, I'm an ambulatory care pharmacist. I work in a PACT clinic, which is a patient-aligned care team, which is something that is basically you work as a multidisciplinary provider. So I work with nurses, LPNs. At my facility, I work with corpsmen, which are active duty Navy hospitalists. And so if they were out, deployed somewhere, they would essentially be the nurses and doctors and pharmacists. So their training is very specific in the area that they work in. They can do procedures, anything like that. So I also work with, our scheduling professionals and psychiatrists, psychologists, social work. It's a very interdisciplinary team.
Yeah.
So the hope is that when your patients come in, it's a one-stop shop for care unless they need something specialized. So for me, I do women's health, ambulatory care, and I'm also the pain pharmacist for our facility. And so in women's health, I do chronic disease state management, manage diabetes, hypertension, smoking cessation, hyperlipidemia, heart failure, asthma, pretty much anything you can walk into the door with, I can manage. And if I can't manage it, I'll try to figure out, or I'll send you to a specialist. I'm able to prescribe medications, discontinue, order labs, respond to labs. So I'm essentially their primary care provider for medication management. And so once I get a patient controlled, so say someone comes to me with an A1C or high blood sugar, A1C of 12. So the sugar is really high. Yeah. I'll manage them with the goal of getting them controlled, which would be an A1C of 8% or less, 7% or less, depending on the patient, within the next 6 to 12 months. And so, I hope it didn't cut me off. And so, medication education, device administration education. We do first dose in clinic with me because a lot of people are scared of taking meds or injecting meds. And then once they're controlled, I try to send them on their way, but usually I've had a few patients sabotage, stop taking their meds, whatever the case may be, and then they come back.
Okay. So I got a question for you. It sounds like you are very forward in your career, where that you get to prescribe medications for patients. At retail, we aren't able to prescribe anything like that. So how is that? Like, do you actually consult with another provider, or you just take it on yourself and be like, I read the labs and I make the adjustments, and you just report it back to their primary care physician?
Yeah, so in the VA setting, pharmacists have a scope of practice, which means that within this scope, this is what we can do. So in that scope, I can prescribe medications and then alter those meds based on lab results or blood sugar readings or blood pressure readings without the consultation to a provider. Patients can consult themselves or self-refer themselves to me. Or their providers will say, hey, this is uncontrolled, go see Dr. Johnson. And I'll be the sole provider for that particular disease state. I can't diagnose any disease state because I'm not a diagnostician, but I can treat something that's already diagnosed. And so, yeah, it's pretty dope. It's, the autonomy you have in the federal setting is it's amazing. That's why I wanted to go into a VA, because I enjoy the ability to make clinical decisions on my own and implement those and actually see the outcome from those decisions, which is not something that you can get a lot in the civilian sector.
Yeah, because
So
I just had a conversation with a pharmacist that works in the hospital, and like you're able to prescribe and change medications. One of the quotes that he said was he takes it out of the physician's brain and then put it into the patient's veins. So he try to like figure out what the physician really wants to do, and then tell him like the medications and the dosing and then the protocol and procedures, and then have that physician like think over it and then write it back. But
yeah,
it probably would be a lot quicker if he could just hear what the physician is saying and then be able to make those adjustments because he's actually dealing with the medicines. But what you're doing sounds very amazing. I wish we all get to that place as pharmacists.
yeah,
We
yeah.
should get there soon, hopefully.
Yeah, well, yeah, I know that people are trying to, since I was in pharmacy school, pass those type of laws where pharmacists have more autonomy, because we are trained clinically in school. We're trained to apply what we learn to patients, but then when you go into a retail setting, you don't get to use those skills. You're kind of boxed in. So it's definitely a great opportunity to continue to grow with my knowledge base, and then I teach residents or precept residents, first year, second year residents, second year students, fourth year students, pretty much everybody.
So how was that? Being that you are a clinical pharmacist and then you are a preceptor. So can you tell us like a day of precepting someone, or how do you, what are their roles with you?
Sure. So it kind of varies on the student or resident skill set, what they're comfortable in, what I'm comfortable with them doing, because my patients are very near and dear to my heart, and I don't want anything to happen to them. And if they don't like something, they will tell me or someone. And so, I try. Education is very important to me, not just for students or residents, but for my patients as well. So I ensure that they are comfortable with their foundational knowledge. So a student comes into me a first day, I'm very relaxed, laid back. It don't take a lot for me, but I ask them what they're comfortable doing. Are you comfortable doing a patient interview? Are you comfortable doing education? Did you look over the patient before you came here to know what clinic is going to look like today? And then if it's their first week, I'll just have them shadow, but I try to incorporate them into clinic and allow them to be as independent as possible. And so usually first year students, they just shadow. I let them kind of come in, or second year students, they come in, I let them interview with me, ask pertinent questions that they feel are pertinent. Fourth year students, they shadow me for the first week, and then I give them particular patients to see. I'll start them with telephone if they're comfortable with that, or I'll start them with a video or a face-to-face appointment.
Okay.
Because we do all three. And then,
I was say, so when you said 1, 2, 3, first year, second year, you're talking about in pharmacy school, or are you talking about residency?
So pharmacy school, the IPPs and APPs, their first, I never remember what those stand for. Experiential learning, I know that part. Yeah. So depending on where they are in school, that's when they'll come in. So for them, it's more of a shadowing experience because they can't do much. And then fourth year is a little more experience and some autonomy. And then PGY1 or first year residents, depending on what part of the year they're in, will depend on what they do. So if I'm their very first rotation, I'm more lenient. They're still learning the system because we work with four different electronic medical records. And so they're still trying to learn the system, how to put in a note, how to order labs and stuff like that. So I'm a lot more lenient. Just kind of help them get their bearings for residency. But if they come to me toward the end of residency, you get a week. Okay.
It's time for business.
Yes, I will push you out. Yeah, push you out the nest. Let's see what you do. I'm always there to be that safety net, of course, and make sure they don't do anything, wrong. But you have to make your clinical decisions in order to feel like you can be independent. You have to pretty much sink or swim, you know?
Mhm.
So unless you learn your own method of practice, there's no way that you'll be able to become independent. You'll always depend on someone to answer, is this right? Is this right? You tell me if it's right. And
Yeah,
then
that's
we go
great.
from there. Mm-hmm.
So it sounds like a lot of mentoring on your behalf of mentoring the students and being a preceptor. And then earlier in the conversation, you said that you had a mentor, which led you to becoming um, a VA pharmacist.
Mm-hmm.
So you also have a business,
Mm-hmm.
hmm Dream
Yes.
Secured Mentoring. So can you
Yes.
talk a little bit about that?
Yeah, sure. So Dream Secured Mentoring Network, LLC. It's a very long name. I started mentoring before I actually, God gave me a name for it and everything like that. I was been mentoring pretty much all my life. And so like one of the girls from my church, I mentored her when I was in high school. She was in middle school, and then when I went to USC, she was in high school, kind of just saying, you know, these are things that you should do. These are things you shouldn't do.
Yeah.
She ended up going to USC, and she's now a physical therapist. But during that process, you know, I kind of helped her along the way of just giving advice of things that I wish I would have known, things I wish I would have done or not done. Just, you know, it's really important to reach back to ensure that the hurdles that you had to overcome, somebody else doesn't have to overcome them. Or the
Yeah.
mistakes you made, somebody coming behind you doesn't have to make those mistakes. Or the fears you have, you know, I'm able to calm those fears and say it's going to be okay.
Yeah.
So it's something I've always done. It's really my passion to be able to reach back to other people and kind of help guide them. And I've been doing it. Now I have a name for it.
Okay. Okay.
And so whether it's a long-term relationship of mentoring, whether I meet you and connect you with someone in a field that you're interested in, I really try to make it a network. There's things that I have desires to do with the network, but I have to get off of my behind and do them. Right now I have a student or a mentee. She's in Maryland and she's interested in going to pharmacy school.
Okay.
And so we're working with her to apply to pharmacy school, going over her application, the steps to that process, helping to build her GPA and really make her resume shine. And then I have a couple of students that are in pharmacy school now looking to do residency. So we're working on redoing their CVs and making sure that they know what should stand out, even just the configuration of the CV. I also help with the interview process. So we do mock interviews. I help them when it comes to how to communicate with residency directors or residents, sending emails, professional emails, how to word them.
Yes.
I have a corpsman who I worked with. She's now in nursing school. So we worked on her nursing application, answering those questions of like, why do you want to be in this field? And, you know, everyone says, oh, since high school, something happened and this is why I want to do it. You know, really honing in on answering those questions and really allowing your application to stand out. So she's at UIC Nursing. Some of the students that I mentored wanted to do residency. So 2 of them are at VA residencies, one in Florida and then one here in Illinois. We worked on, again, interviewing skills, how to present yourself, how to really, even if it's something negative. So I have 2 mentees in California. One is just starting out in undergrad and trying to figure out, what am I doing here? You know, and then there's life circumstances that come into play too. You know, some have children and they're trying to figure out, how do I go to school and have a family life?
Yes.
I got 2 cats. I don't know.
We see
But
her behind you right now.
do you really? Oh my
Yeah,
God.
she's just hanging out. It's all good.
Yeah, that's Chloe.
She won't.
They need a job.
It seems like you are an empowered leader and like you're reaching
Yes.
back and empowering the next generation of leaders. So
Yeah.
with your business, it sounds like you're helping with the resumes, you're doing mock interviews, you're doing the resume CVs, resumes, mock interviews, and it seemed like you're getting everyone from the beginning all the way to the end, like from starting high school all the way into what you want to become a nurse, I think.
So I have a few. So one's a nursing school, one went to physical therapy school. She's a doctor of PT, and now she's in her first year of residency in Florida. I have a few students in pharmacy school pursuing residency.
So the network that you're building is not just pharmacy, it's all fields and aspects
Professional
of life,
fields, yeah.
all professional fields.
Yeah.
So how can someone reach you to get in contact with you, to get into this network, and how can someone reach you to become a mentee of you?
Sure. So emailing me at secure.dream@gmail.com would be the easiest way to contact me. I have Dream Secured Mentoring on Instagram. If you need to find me there, I can, for some reason I'm blanking on the name, but it is Dream Secured Mentoring, or Dr. Danielle J on Instagram. And that would be the easiest way to contact me. I'm on LinkedIn, Jessica Johnson on LinkedIn. I actually had one of my resident or mentees reach out on LinkedIn. She's in, I want to say Ohio, maybe Oklahoma.
So locations isn't a problem with you help mentoring.
No, you can actually schedule with me on my Dream Secured Mentoring Instagram page. And there's a place to schedule if you wanted to come in and do either like a 1 hour or so initial meet and greet, or if you just like, girl, I don't know what to do, I just got out of pharmacy school, what am I supposed to do? It doesn't matter. Like one person reached out to me on my Instagram page, and she's just trying to figure out what to do with her next step in life after graduating pharmacy school. So she's moving to Houston, and it really is an encouraging network too. So, you know, if I don't know the answer, I find someone that does. But it helps me, it encourages me too to keep progressing forward as well. So it's pretty awesome. You know, everything doesn't work out perfectly, and I'm not here to make sure that all of your dreams come true. I'm not a fairy godmother or anything like that. I wish I could. You know, everything doesn't pan out the way we want it to, but I turn those into areas to grow. What is it that God wants you to learn in this moment? And then how are you supposed to grow from it? Because there's never a, you know, oh, this didn't work out, so now my life is over. That's what I tell students in pharmacy school. When you graduate from pharmacy school, if you don't get into a residency, what will you have? A job, a doctor of pharmacy degree. You will get a job.
One thing COVID has taught everyone is how to pivot and make the best out of the situation.
Exactly.
Because I even applied for a residency. I was trying to get a I think it was a managerial residency. So I would have came out the residency and become like a director of pharmacy at a hospital or something like that. It would have been a 2-year program. But I wasn't able to get it. So I just had to pivot, got into retail pharmacy, and then just worked my way up the ranks from becoming a floater pharmacist to becoming like a pharmacy manager.
That's hard. That is hard work. You really have to work your behind off to get that. So
that's one thing COVID did. But you said it a few times, like if you don't know the answer, you're gonna find it. So that's one thing pharmacy school taught us. We're looking into all those reviews, resources. Like if you don't know the answer, find it. Never make it up. If you can't find it, ask someone. Like keep doing more research. So that's great.